I'm Angenette Levy, and this is Simply Medicine on 55 KRC, the talk station. Well, it's Derby weekend, Kentucky Derby. It is today, and there is actually a horse in the Kentucky Derby named Cyberknife. We're going to hear more about what that means, and there's a good tie-in here with the Urology Group in Cincinnati. And joining me to talk a little bit about that is Dr. Mike Dusing. He's a urologist with the Urology Group. Dr. Dusing, welcome to Simply Medicine. We're really excited to have you.
Thanks for having me.
Just so our listeners know, he's wearing a fabulous pink blazer, very Derby. So,
well, Angenette, I was born and raised in Kentucky, so I had to sport my home sport.
That's right, and you're doing very well today. First of all, let's talk about what Cyberknife is, and we'll get to how it ties in with the Derby later. But talk to me a little bit about what Cyberknife technology is and how you use it at the Urology Group.
Well, Cyberknife is a radiation technology, so it doesn't really knives. It's an advanced radiation technology that we use to treat prostate cancer. It allows us to treat men in a shortened period of time compared to some of the other available radiation-based treatments. And a man with prostate cancer can be treated in as short as 5 days and simply get through his treatment with very minimal downtime.
So even though it's called Cyberknife, we're talking about, cyber is computer knife. So it's not an invasive procedure.
Absolutely non-invasive. And I actually have patients that will be treated during their lunch hour and go back to work and really don't skip a beat during their treatment process.
Wow. So they don't have any side effects, maybe nausea, things like that from Cyberknife? Because it is radiation and sometimes there can be side effects.
Correct. Very low side effect potential. A lot of men are worried about losing their hair or having side effects that are related to sometimes chemotherapy. This is radiation. And the most common side effect would be maybe a little bit of tiredness. The room that we treat men in is nice and dark. It has cool lights. It has great music that the staff play. And sometimes just the relaxing nature of it can make you just feel a little bit tired. But most men have very minimal side effects the day that they are treated and through that treatment.
Is Cyberknife used to treat advanced prostate cancer, or is this something you can use in the early stages?
Prostate cancer does come in many varieties, and it's good that you bring that up. Depending on the stage and grade of the cancer, it really dictates what's available to men. Cyberknife is typically preserved for the guys that have low to intermediate risk disease and maybe some special cases with high risk disease. We
are here talking with Dr. Mike Dusing. He is a urologist at the Urology Group in Cincinnati, and we're talking about Cyberknife technology. It's a non-invasive radiation technology used to treat prostate cancer patients, and there's a tie-in with the Derby. Guess what? There is a horse in the Kentucky Derby named Cyberknife. And so, Dr. Dusing, tell us about how you all have placed this bet on Cyberknife, and it's an $1,152 bet from what I understand, because that's the number of patients over the last 3 years you've treated with Cyberknife.
Well, Angenette, when I saw the list of the horses coming into the Derby, I had to take a double take. I couldn't believe that there was a Cyberknife. When I first saw it, I didn't know that there was a relationship with a patient that actually owns the horse. So the bet, our practice, the Urology Group, will be placing, yes, a $1,152 bet on the horse to win the Derby. And that actually represents every patient that's been treated since the horse was born in its young three-year-old life. So that number is the number of lives treated during that 3-year phase.
What are the odds for Cyberknife? Because I'm not going to lie to you. I was not good at statistics in college. I'm like really bad at this stuff, and I'm not good at reading odds. I'm not a big gambler. So how is Cyberknife ranked? I do know enough to know you could have bet on him to win, place, or show, or what is the bet and what are his odds?
Well, the last odds that I've heard is a 20 to 1 odd, and he's going to be in 16th position at the start of the race. Now, obviously, the odds change as time goes on, but currently it's 20 to 1 that I heard last.
Okay, is that good or bad?
It's decent.
And the bet, is it win, place, or show? Or is it part of like a trifecta or something?
The details of the bet, I think that's for the win. But obviously, all my colleagues and myself will be placing bets on this horse And the variety of beds just depend on your flavor, what type of bed you like.
You're really getting me interested in this, and I feel like I need to run down to like Belterra Park or something and place a bet
Well, absolutely.
on somebody. Because like one time, just so we know, and I'm kind of straying off topic, but I think it's okay. I actually, one time, like several years back, I was like, I should go bet on this horse. I really like the name, and I don't remember the name, but I was like, I really like that name of that horse. I should go down there and place a bet. I didn't. Guess what? Horse won. So I might have to look at the horses and see what I can do. So you're rooting for Cyberknife. What happens to the $1,152 bet if Cyberknife wins?
By Angenette, any winnings we're going to donate to the cancer support community, which is a local cancer charity group.
That's amazing. So let's do the math here. 20-1 odds at this point. If it wins, how much money is that?
It would be over $20,000.
Holy smokes, that's really, okay, I thought so. 20 times 1152. Wow, okay, so that's great. If he wins, that's amazing. So Dr. Dusing, we really appreciate you coming on, and we wish you and Cyberknife and the rest of the patients good luck, and we'll be watching later today. We will update our listeners next week on the results of the Derby.
Thank you, Angenette.
And that does it for this week's edition of Simply Medicine. I'm Angenette Levy. Thanks so much for being with us.